The world
Non-communicable disease.
non-communicable disease. Worldwide statistics, if you see, there are 41 million deaths every year because only reason is non-communicable diseases. So amongst these significant deaths, so early deaths like 40 to 60 years age, early deaths are because of these non-communicable diseases. So non-communicable disease, there are major four factors, four diseases, group of diseases which are highly responsible for non-communicable disease. First category comes is heart-related problems, hypertension, myocardial infarction, cardiomyopathies, and other heart-related problems causes early death. Second one is cancer. Third one is chronic obstructive pulmonary disease (COPD), and fourth one is diabetes. So these four major categories of disease can cause early death. So when we talk about integration therapies, majority of the doctors are busy in fighting the disease which are either communicable diseases or which are advanced new diseases or which are uh, comorbid conditions. So we are not exactly focusing on the disease reversal as such. If I say illness to wellness continuum, and towards the center of the illness wellness continuum scale, there is a neutrality. Towards the left, there is a grades of grade 1, 2, 3, and last is death. Towards the right, there is a optimal health and wellness. So we are not going towards neutrality of the health. Majority of the times, all the specialists are busy with treating the disease. No doctor have a time to reverse the disease. No doctor have a time to teach you about exercise, how exercises will help you, how increasing the lung capacity can help you to fight with the disease, reduce the medication dosages and all those. So integration is a pure new age healing method where you can add the you can complement and add along with the modern medicine as an adjuvant therapy without fighting with each other as in alternative medicine. So you can integrate best of the conventional medical practices and best of the complementary medical practices. So this is similar to Dr. Rawat's works also.
How you can say that?
So you're also focusing on body, mind, spirit, and incorporating the integrative concept into the mainstream of the medicines.
I took it from Susumu Tonegawa, who had Nobel Prize in Generation of Antibody Diversity. In Review of Immunology, Annual Review of Immunology, you can read his long article on psychoneuroendocrine immune super system. So in 1986, we were taught by our professor M.C. Goel. That chapter, he had at that time didn't get the Nobel Prize, but he got, I think, in 1987 or something. So we were really introduced and primed to what you are saying to me, psychoneuroendocrine immune system, in that time. And the next was when I went to UK during my research an experiment. My gene knockout animal died, or were to be killed, not died. The interleukin 4 gene knockout mice, they developed aggressions. They were in groups, and they have to put to death because of animal cruelty. Allegation would have been there. So that was the second thing. Second was that thing where I couldn't explain the aggression of the removal of the gene of interleukin 4. Why the removal of the gene of interleukin 4 created the aggression in the mice. So there slowly I connected the threads and it came to Ayurveda and Yoga. The earlier learning of 1987 of psychoneuroendocrine immune system was experimentally seemed valid. And then 2002 onwards and up to now, I am interacting with people at the apex in Ayurveda in the country. And 25 December I am interacting with you. So
it's a great honor to even meet you, sir, to sit in front of you. That's a great honor.
Wonderful feeling for me as well.
Yes.
That I'm getting the culmination, we call it Utkarsh, of this journey.
Different streams.
different streams. I had some sharing of the panel discussion at Banaras Hindu University of World Ayurveda Congress in 2019, and another proponent she is Basmati Bhattacharya. She is a global best author of Daily Ayurveda. She shared. She is also MBBS MD from Harvard Medical School. You can find his
Yes.
citation speech in YouTube,
Yes.
and she also has a lot of respect to the integration, and she is practitioner of that. Ashok Vedya is another one who I happen to meet him. So in Ayurveda congresses, two I attended, big one in uh, Cochin also in 2002. I had met more MBBS MD who believed in Ayurveda, and also medical Ayurveda you
Yeah, we can practice.
you practice. So
With the help of other doctors, where they are from different stream of specialists, like 8 streams of Ayurveda, Ashtanga Ayurveda.
uh,
Each doctors will give, so we'll share the common particular disease patient with them, and we'll share a common medical history and all those. We give our diagnosis, or already diagnosed patients will come and they'll add their inputs. Their added inputs will take it in as a challenge, and we'll see, we'll work it out. What fact would have worked? Either bowel evacuation in terms of virechana, or the local oleation of the oil massage, it has helped increase the blood circulation. All these things we can correlate and we can tell. Like there are a lot of research which says that Shirodhara helps cluster headaches, migraine headaches, because it will increase the vasodilatation of intracranial and extracranial blood vessels. So that is a perfect factor where best of the modern medical inventions and the ancient inventions can be correlated and put it across in the verbalized form, where they'll understand. Logical thinking people also can understand, and the experimental people, the emotional people also can. Right brain, left brain people can understand and accept it.
great.
If you give it in the evidence-based format, they'll accept it much better.
Yeah. And then there are very foundational and fundamental issues in many of the pathophysiological situations. So that can be, understood through the available evidences
Yeah.
and correlate with the experimental work.